Breathing secondhand smoke can stunt my growth, give me ear infection, asthma, lung infection, and cancer. Please, don't smoke when I'm around.
Globally, 600,000 people die each year because of secondhand smoke. 28% of these dead are children. There is no safe level of exposure to secondhand smoke. Indoor environment should be 100% smoke-free to significantly reduce the risk of cardiovascular disease and cancer. The WHO Framework Convention on Tobacco Control was forged to curb the global tobacco epidemic. It was agreed that action should be taken to protect everyone from the dangers of secondhand smoke. Understandably, the road to smoke-free air is difficult. Despite efforts of ministries of health in the Western Pacific to institute laws and enforce regulations, millions of people are still exposed to secondhand smoke each day. In China, Vietnam, the Philippines, Cambodia, Republic of Korea, Malaysia, Papua New Guinea, Solomon Islands, among others, thus increasing the number of deaths, placing a heavy burden on healthcare systems, reducing productivity, as well as the chance to rise from the clutches of poverty. But there is hope. It appears that there is growing public support for smoke-free environments. In fact, an estimated 88% of youths in the Western Pacific favor a ban on indoor smoking. In Hong Kong, from 2007 to 2008, despite fears of how a smoking ban would affect restaurants and bars, sales increased by 13.4% and 9% respectively. Undoubtedly, civil society is going to be key in spreading awareness of the importance of smoke-free air and pushing for stronger legislations to achieve it. With that in mind, we present the Blue Ribbon Campaign, a program in support of the efforts already instituted by ministries of health to save more lives from secondhand smoke. The Blue Ribbon Campaign is a public recognition of partners in civil society who have contributed greatly to advocacy for protection against secondhand smoke. Objectives of the campaign are to raise awareness of the harms of secondhand smoke, to recognize and empower allies in civil society to continue changing social norms and advocate for smoke-free environments, to build political constituencies that can lobby for stronger smoke-free laws and regulations. To implement the Blue Ribbon Campaign, your WHO Country Office Tobacco Control Officer can help you develop a plan. However, full ownership of the program remains with ministries of health. How to plan a Blue Ribbon Campaign. First, organize a steering committee. The steering committee is your core group. It is composed of the National Tobacco Control Focal Point, other program managers in the Ministry of Health, and members of civil society. The steering committee develops a plan for recognition, implements the plan, and evaluates progress. A symbol that is culturally accepted and meaningful is selected by the group. Note that the blue ribbon design is not mandatory. The steering committee may change it as they see fit. A call for nominations is announced through print, radio, and other media. Nominees are required to submit an application form with a description of their work and its impact on society. Selection is based on criteria set by the steering committee. Once a deserving nominee is selected, the selection is announced at a big event to which the media are invited and where the recipient's notable contributions are given due recognition. The Blue Ribbon Campaign is envisioned to communicate social solidarity for smoke-free environments. With ministries of health and members of civil society working as one, it is only a matter of time before we can achieve our shared goal of 100% smoke-free environment.